Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing swollen lymph nodes, okay? But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So I'm going to talk about a specific type of swelling for lymph nodes, okay? So it's called reactive lymph nodes, okay? This is when the lymph nodes swell in because there's either an infection or an injury, okay? So this is called reactive lymph nodes. So lymph nodes house B cells and T cells. So this is an essential type of blood cell, a white blood cell, and it fights off infection, okay? So bacteria and viruses. So when something goes wrong in the body, the lymphatic system produces fighting cells to fight bacteria, viruses, and other causes of illnesses, okay? The lymph nodes swell in the process, okay? So when it produces these cells, it starts swelling. So normally, the lymph nodes will be near the site of infection or injury, okay? So the main symptom of reactive lymph nodes is swelling, okay? So swelling of the actual lymph node, but they can also have swelling around the tissue on the outside of the lymph node too, okay? So the body contains hundreds of lymph nodes. Most often swelling is in the neck, around the face, behind the ears, the groin, and under the arms, okay? That's where we have a lot of lymph nodes. Now, if we have swollen lymph nodes due to an infection or an injury, the lymph nodes closest to that site is normally what swell. So what they'll normally see is a lymph node about the size of 1.5 centimeters in diameter, soft, movable. The swelling is usually only in a specific lymph node or group of lymph nodes, okay? So normally lymph nodes are grouped together, so you could have some in that area, and it's not normally throughout the whole body, okay? So reactive lymph nodes often accompany an infection or injury, so you might experience other symptoms with this. So fever, pain, tenderness near injury site, symptoms of illness, signs of infection or injury, just generally feeling sick, okay? Just because the lymph nodes are swollen, it doesn't mean it's a severe infection, okay? Some people just, their bodies have that reaction where their lymph nodes swell up and they actually don't even feel sick. So treatment. Treating lymph nodes really depends on the cause. So when a person has no symptoms of infection and the swelling goes away on its own, you really don't need to do anything, okay? When the infection causes reactive lymph nodes, a person may require antibiotics. For more severe infection, the patient may stay in hospital to receive intravenous antibiotics. Or if they have a weak immune system, the doctor may opt for them to stay in the hospital too, because they do need to monitor even minor infections. So treatments are available in many forms. So sometimes the swelling is caused by cancer. So early detection is needed for this. Depending on the type of cancer the person has, the lymph nodes may be removed, chemotherapy or radiation. You should not avoid going to the doctor in fear of having cancer, because treatment needs to be started right away, so the cancer doesn't have time to grow and spread. So when should we see a doctor about a swollen lymph node? So they can be alarming. It can be kind of scary to feel a little lump, especially if the swelling is unclear. But most of the time, swollen lymph nodes are a sign that the body's immune system is working well, okay? So people with HIV or AIDS or are taking immune system suppressing drugs, they should call their doctor right away if they notice a swollen lymph node. For most people, I'm going to say this, for most people, now I am not a doctor, I am not your nurse, okay? This is generalized information. It's not specific for you and your case. This is just general information out there for anybody to see. But in general, it is safe to wait 1 to 2 weeks if symptoms, to see if symptoms will go away before you see a doctor, okay? See a doctor within a day or two if you have the following: swollen lymph nodes after having a skin injury, newborn that has swollen lymph nodes, or if you have a fever alongside with it, okay? If a person has no signs of infection, a swollen lymph node might be a sign that it has successfully fought off infection, okay? So it is safe to wait that 2-week mark. If it's still there, you should be discussing this with your doctor, okay? Or if it's larger than 1.5 centimeters, make sure you're seeing the doctor. Okay, so what is the outlook? So lymph nodes do swell for many reasons. Most of the time, it is harmless, okay? Most of the time, it is harmless. It is important to recognize swollen lymph nodes as the body's sign that it is fighting an infection, okay? Especially in chronic wounds, which that's really what my channel is about, chronic wounds. Your body has a high chance of having bioburden on that wound, okay, where it does have a high presence of bacteria. So your body is trying to fight this, okay? Now, a doctor can help with determining whether a person has a serious infection that warrants treatment, okay, antibiotics, whatnot. They can assess you for this. Now, sometimes lymph nodes do remain swollen long after infection has disappeared. Okay, as long as the lymph node isn't changing, isn't becoming hard, okay, it's typically no problem. If a person noticed that a lymph node changes, hardens, grows very large, you need to be seeing a doctor, okay? Have it assessed, have it looked at, just so the doctor's aware of what's going on. But most of the time, like I said, it's really harmless to have these swollen. So that's all that I have for this video. I hope it did give you a better understanding of why lymph nodes do tend to swell, especially in cases of infection or skin injury, okay? Really any injury in your body. But once again, that's all I have for this video. I hope to catch you in my next one. Bye for now.